Thanks to advances in veterinary medicine, animals are living longer than ever before. However, an increased lifespan also brings more problems that afflict older animals. The golden years are marked by a variety of conditions and diseases, including glaucoma and other vision problems.
If they could tell you that they're starting to have problems seeing, then it would be much easier, but sometimes it's the veterinarian that identifies that something is just beginning and ends up saving the vision for that pet.
The American Animal Hospital Association, in its senior care guidelines, recommends that healthy senior dogs and cats visit the veterinarian every 6 months for a complete exam, including ophthalmic evaluation.
Unlike humans, where glaucoma can be a gradual increase in pressure, it's much more common, particularly in dogs, where the pressure can suddenly shoot up. And if you don't have a means of checking intraocular pressure, you're going to miss a very serious vision-threatening ocular disease.
Glaucoma and uveitis are often missed because of failure to measure the animal's intraocular pressure, or IOP. This can be disastrous for the animal.
If a patient presents with a red eye and discharge and they're sent home with a diagnosis of conjunctivitis, they have just destined that eye to permanent blindness. It's that fast. So had that veterinarian checked the intraocular pressure and made the diagnosis of glaucoma, that at least they have a chance to save the vision in that eye.
IOP testing requires a portable tonometer. The best choice is the AccuPen Vet because it provides more accurate and precise measurements and displays and stores more information than other tonometers. AccuPen Vet is also the best investment for your practice. At $2,995, the AccuPen Vet costs $200 less than competitors' instruments. Operating costs for tip covers and batteries are also significantly more economical. The national average charge for glaucoma screening is about $30. Performing only 10 tests a week will repay your investment in about 2 months. Glaucoma screening can become a major profit center for your practice.
My staff has all been trained in the use of tonometry, and we'll double check each other. So if there is an abnormal reading, then usually I get called in and I confirm or deny that the pressure is what it is.
The AccuPen Vet is lightweight and has a great ergonomic design that fits comfortably in any hand. This video shows the proper techniques for getting the most out of your AccuPen Vet tonometer. Taking a measurement. After anesthetizing the animal, a tip cover should be placed properly on the transducer. Tip covers eliminate cross-contamination and protect the transducer tip from dust and liquids that could potentially damage the unit. Simply roll the cover on using the cardboard applicator. This photo shows a properly placed tip cover. Pleats indicate proper tension while allowing the transducer pin to move freely. Tip covers that are too tight can introduce false resistance to the transducer pin, and IOP measurements can read higher. Tip covers that are too loose can fold over or crease and possibly create erratic measurements. To turn on your AccuPen Vet, press any control button. The product information briefly scrolls across the screen. The measurement screen will soon be displayed. To take a measurement, press and release the Action Control button. It's important to make sure the AccuPen is in the measurement position when this button is pressed. Shifting of the transducer tip from movement could lead to erratic measurements. After pressing the Action button, the AccuPen Vet will beep twice, indicating it's ready for measurements. Gently tap the transducer tip on the animal's cornea. The probe should be perpendicular, and measurements should be taken at the center of the cornea. As you gently tap the cornea, you will hear short chirps followed by one longer chirp. The longer chirp indicates you have obtained an IOP measurement. The number of short chirps can vary. The AccuPen Vet has a proprietary algorithm which eliminates the need for a confidence factor. The AccuPen Vet has the ability to store 9 IOP measurements. Once you have completed a measurement, you can simply press the Action button to take another measurement if necessary. The top number on your liquid crystal display shows the actual IOP measurement. The number below is the average measurement. To scroll through multiple measurements, simply hit the arrow buttons. If you have taken multiple measurements, an asterisk next to one of the numbers will indicate the furthest from the average. To delete individual measurements, hold down one of the arrow buttons for about 3 seconds. The unit will chirp, indicating the measurement has been deleted. After deleting one measurement, the AccuPen Vet will automatically update the average IOP. To clear the AccuPen Vet completely, hold down both arrow buttons for about 3 seconds. The unit will chirp, indicating the measurements have been deleted. The AccuPen Vet features gravity offset technology, eliminating the need to calibrate your instrument frequently. When calibration is needed, hold the up arrow and action buttons simultaneously for 3 seconds until the probe HORIZ display screen appears. Hold the transducer horizontal to the floor and press the action button. The unit will chirp and display probe up. Hold the unit so the transducer tip is pointed directly in the air and press the action button. The unit will then chirp and display probe down. The last step in the calibration requires the user to hold the unit so the transducer is pointed directly towards the floor. Press the action button. A calibration number will display on your screen. Consult your user manual to confirm this number is within 30 of the engineered calibration number. When calibration is complete, the unit will feature a number under the probe. If your screen displays a no calc, the calibration process was not performed correctly. Please try to calibrate your unit again. If the unit displays an error message, please consult your AccuPen Vet representative for further support. Other helpful tips include grasping the lanyard at all times to prevent your AccuPen Vet from dropping. In a vet setting, it's important to always keep a tip cover on the unit even when not in use, and store it in its proper case with the tip cover on. Be sure to keep your AccuPen Vet out of extreme temperature conditions, because extreme heat or cold can affect measurements. Inserting the battery. When you first unpack your AccuPen Vet, the 3.6-volt lithium battery must be placed inside the unit. Take the screwdriver to open the casing and place the battery inside the unit. Use a screwdriver to tighten the compartment shut. Be sure not to over-tighten the screw. Batteries typically last 15,000 measurements or 1 year and can be purchased from your AccuPen Vet representative. Compressed air can be used to clean the tip of your AccuPen Vet. Shoot the can on an angle at the transducer tip. Do not shoot the compressed air directly into the transducer. Do not hold the can upside down because liquid can enter the transducer tip. An ultrasonic cleaner can also be used to clean the tip. Expose only the tip into the ultrasonic bath. It is important to dry the tip immediately after cleaning. For other precautions or questions, consult the AccuPen Vet user manual. Thank you for choosing the AccuPen Vet, where the difference is visible.